Today marks National Black HIV AIDS Awareness Day. It is an opportunity to increase HIV education, treatment, and testing in Black communities. Now, according to the CDC, African Americans account for a higher proportion of new HIV diagnoses and people with HIV compared to other races and ethnicities. Joining us today is the president and CEO of the Black AIDS Institute, Raniyah Copeland. Thank you so much for being with us this afternoon.
Thank you so much for having me.
You know, with all this talk about COVID, I feel like, other conditions have sort of taken a back seat because we're so focused on COVID. But I would think that being in the midst of a pandemic, the fact that it is affecting people of color so much more than other parts of the community, that this certainly, there's some similarities there in terms of how our community should confront this pandemic as well. Talk to me a little bit about that, this intersection between HIV and AIDS and COVID.
I mean, there's such a huge intersection. You can look at who is leading our COVID response now, and you can see those are the same leaders from the HIV movement. When you look at the scientists and researchers, Dr. Fauci has been a huge advocate leader in HIV and leading new technology and really kind of even leading this initiative to try and end HIV within the next 10 years. And he's, now the architect and, the leader around COVID. And then we see healthcare organizations and community advocates that have been, a hallmark of the HIV movement, HIV activism, really trying to respond to HIV that are now responding to COVID. And so, the last pandemic we went through as a world was the HIV pandemic that still exists and persists today. And so there's a lot of lessons to be learned from how we responded to HIV, the successes we've had in responding to HIV, but also the challenges that really still persist that make HIV an epidemic that really is continuing to ravage and disproportionately impact Black communities.
And so with so much attention being focused on COVID and so many resources going towards COVID, how to fight it, how to get people vaccinated, how to even get some people to take COVID seriously. Yeah. Do you feel like perhaps the fact that HIV and AIDS is still ravaging the Black community is lost on people? Do you think that that part of the population is not necessarily getting the attention and resources that they need?
Yeah, I mean, I think that across the country, what we're seeing is decreased number of people who are getting HIV tested, right? Because clinics and organizations and health fairs are closed. So places where people would get HIV testing have been dramatically impacted. So we're seeing a decrease in HIV tests, which means, and that doesn't mean that there's less HIV, that just means we're not diagnosing it, which is a problem. We're seeing people not attending visits, particularly people who are living with HIV, who are supposed to be attending their clinic appointments, visiting with clinicians every quarter, every 6 months or so, those appointments being canceled. There's lab work that has to be done. We see a decrease in those visits. And then we're also seeing a decrease in filling prescriptions for HIV medications. 40 years now, almost into this epidemic, it's amazing that we can say that we have these biomedical tools, these medications that could theoretically end HIV. So people who are HIV negative can take a pill every day, pre-exposure prophylaxis or PrEP, and they won't acquire HIV. People who are living with HIV can stay on medication, achieve viral suppression, so their viral rate is so low that they can't transmit HIV to other people. So not only are they living long and healthy lives, you don't have to worry about that fear of transmitting HIV to others, but all of this is because of these medications. And we see less prescriptions being picked up. And so, I think that HIV is for sure one of the many, diseases that is not getting its attention that it needs because of COVID. And it's the same communities that are being most disproportionately impacted by COVID.
Let me follow up on that. Why is it that the level of HIV and AIDS, especially as it affects Black women, why are we not seeing a reduction in those numbers as we're seeing in other parts of the population?
It's similar to COVID as well. The reasons why Black communities are disproportionately impacted by HIV is not because of things that we are doing as individuals. It's not because we're having more sex with people, we are using condoms less, or we're injecting drugs more. It's none of those. And in many cases, Black communities actually have less sexual partners, wear condoms more often. It's because of these systems of oppression that really impact Black lives every day. So we can connect HIV rates to mass incarceration. We can connect HIV rates to intimate partner violence with women, so women who are abused. We can connect HIV rates to education level and poverty level. And all of these things we know really are influenced by, these systems of oppression, lasting racism within systems and structure that really impact access and opportunities for Black communities and Black individuals. And so that's, why we see these high rates. And I think that COVID provides a unique opportunity because this is going to continue to happen, whether it's COVID or heart disease or HIV. And until we really respond to the reasons why Black communities are disproportionately impacted and, impacted by these racist systems, we're going to continue to see Black folks being impacted by,
disproportionately.
And all kinds of other things that really kind of affect our ability to live and thrive.
Before I let you go this afternoon, could you talk to me a little bit about your Black Voices campaign?
Yeah, so we don't hear as much about HIV as we used to. We have all this data to show that the height of HIV kind of media coverage was when Magic Johnson came out about his HIV status. And since then, we've seen a steady decline. And we have these amazing advocates in Black communities, particularly Black celebrities, Black influencers who have this really large platform and really getting to utilize their voices, their celebrity to take the message around HIV and how we can actually end HIV within our lifetime to folks across the country. And so we're really grateful to be able to have amazing folks like Mrs. Tina Knowles Lawson, like we just did a conversation with Cheryl Lee Ralph, to be able to talk about HIV and how really it's going to take us as a Black community coming together to make the change that we want to see.
Yeah. Raniyah Copeland, Black AIDS Institute. For more information about the organization and how we can be a part of this effort to educate folks about HIV AIDS, blackaids.org.
Yes.
Right?
Yes,
Okay.
yes. You can follow us on social media as well. We have lots of information, amazing website with great information for folks.
All right. Rania, thank you so much for being with us this afternoon and keep up the good fight.
Thank you so much for having me.
Sandra Bookman, and Here and Now. We'll be right back.